Hello. Nice to see you.
Nice to see you as well.
Earlier on, when Christine was having the antibiotics via the venous access line, the nurses were in sort of very regular contact, visiting very closely, helping support her husband who administered the therapies. And I think that made a huge impact on their lives, because in supporting them in doing that, they were able to manage to keep Christine at home for that period of time. The alternative would have been that she would have been hospitalised, and I think that was better for her morale, her well-being, and really sort of better for her husband also. Although there was a big responsibility on him, he felt he was able to contribute, and from what he tells me, I think he quite enjoyed being a part of her care, but obviously having the nursing support around them was very fundamental and very important.
Well, they've supported my husband, which obviously that was a big factor, because he's my main carer, and we were both dealing with something which was totally unknown. Not many people had come across the illness, and I found that he also could talk to the nurse without feeling that he shouldn't be able to ask them questions. He felt he did have the courage to do this. They gave him that courage to carry on, to proceed, that you know, it was okay to ask questions. Initially they thought the line was going to go in the arm for 6 weeks, but that didn't work, so the Grosjean line went in the chest, and it was in for nearly 14 months. The first infusion would be 6 o'clock in the morning, so Fred would have to get up at 5, prepare, scrub up, prepare. Then the next one would be at 12 lunchtime. The same procedure, he would start then at 11 to get everything ready. 6 o'clock at night, the same, and then 12 o'clock midnight. So by the time Fred got into bed, he was totally exhausted. But then we found, by being able to discuss this with nurses, and we would share the worry, because sometimes I would have a blood clot in the line and the nurse would be here immediately, and I would go to hospital and they'd flush it, but it definitely, we couldn't have coped with that team effort, and that's something I hadn't experienced before. And it was amazing. It got me through very, very dark times. You know, I could have a good cry and nurse would hold my hand, and then I'd laugh at the end, and you'd get that smile back and that hope to carry on.
Latterly, we've been sort of very closely involved in giving Christine ongoing support. Her condition is palliative, and we're here for her to help her with the difficult, complex symptoms that she experiences. As a specialist nurse, I'm involved in helping her with that, but I don't work in isolation. I work as a member of the integrated team, and the case managers are very closely involved. They give psychological support as well as helping with the symptom issues that arise. And we take an holistic approach to her care. We're supporting physically, psychologically, practically where we can, and hopefully it's a complete package of care. And I hope that both Christine and her husband feel that they are very closely supported by a strong network of care, and they do feel that we are a caring organisation.
They supported me in a way that gave me the hope to carry on, that I wasn't alone anymore, that I could cry, I could let my feelings show. I didn't have to hide them from my husband anymore. I had someone who I could trust to talk to. That has been a big factor. Without them, I don't think I could. I know I would not have coped. Being able to trust someone, knowing that they wasn't going to think, oh, what's she going on about? They understood everything that I was going through, and I found that amazing.
The community nurses and myself work closely together to provide a strong network of support, and we respond to the needs of the patient. And it may be that we might go through a very intensive period where they're needing very close, immediate support, and then things may settle and we may sort of take a step back while things are nice and stable, but we're there ready to respond as conditions change, as symptoms change. So we step in and out according to what patients' needs are.
I find a lot of people, they're afraid of care. They feel that they shouldn't have nurses, they shouldn't have a Macmillan nursing or district nursing. They can cope on their own and they struggle. And I would say to anybody, whatever illness you've got, never be afraid to ask for care, because it saved my life. It really did. I know I'm never going to be cured, but at least I know that I've got help there, I've got nurses there. You don't always necessarily need the doctor, but you always need your nurse, always. You are one person I can phone. You bring me to tears. They've been amazing, and they've given me the hope, a hope to carry on. All right, I'm going to have bad days, black days, but they're always there at the end of the phone, if not in person. And thank you so much for getting me through this difficult time and helping me and giving me the courage. And I can cry without feeling guilty. Thank you.